There was a lot to adjust to when mask wearing came into effect earlier this year, like how to keep your glasses from fogging up and finding the right fit. One thing many of us noticed, though, was that we had some bad breath. Well, some of that can be attributed to your morning coffee or garlicky meal beforehand. It's good to be aware of chronic bad breath and what that may mean. Anaida Deti, the owner of DentalX, is a full dental office here in Vaughan that offers everything from dental cleanings to complicated extractions. Anaida is joining What She Said Talk as a regular to share information on dental health and why it is so important that it's just more than your smile. It can impact your general health in a big way. Today, though, we're going to tackle the problem of 2020, that stinky breath behind your mask. Welcome to the show, Anaida.
Thank you.
So I think a lot of us, when we just got used to this mask wearing, I know I was maybe a couple of days into it, walking through the grocery store, and I thought, good grief, is this what people are smelling when I'm talking to them? So when does bad breath become a problem?
So usually having a bad breath is something quite normal, especially like in the morning or even like at nighttime. So it's very important to have regular brushing and flossing. The most important thing is also brushing your tongue, something that people don't really know, that you have to brush your tongue. Because most of the bacteria stays in the tongue, not so much on the teeth and in the gums. So if you are doing all your work, and if you are brushing and flossing and doing all the proper things, and if you see that you are still having bad breath, then you have to go a little bit further. So then you have to see a dental professional, and then you have to make sure that you have, like if you have periodontal disease, if you have cavities, or if you have bigger things that you need to be taken care of.
So what is periodontal disease then?
So periodontal disease is when it affects the gums and the bone. So then all the bacteria that stays on your teeth goes further. It goes underneath your gums, and then it affects your gums and your bone, and then the bone shrinks, and then what causes your teeth become loose, and then you lose your teeth. So it is very important to make sure that you see your dental professional and see if you have periodontal disease.
What are the treatments for periodontal disease?
So the treatments are, you have to start with cleanings, which is very important to have. It depends if it's every 3 months, every 4 months, or every 6 months. That's something that your dental professional will let you know. And then after, if you see that, like it's going, that it's not getting treated, then you have to make sure that you see a periodontist, and then decide if you need any bone grafting, or if you need something that is a little bit more complicated, like surgeries.
Let's say it's not periodontal disease and it's just bad breath. Is there a way we can treat that? Like, I think everybody wants to reach for gum or mints. Is that the best way, or is the fastest way, or is there a better way?
Sometimes is, like just to kind of treat for a short period of time, it's not a bad idea to use a little bit of like a mouth rinse, or even something that, like a mint or gum. Those are things that are just to treat like in a very quick way. I'm not a big fan of mouth rinses, because most of the time the mouth rinses dry the mouth a lot. And especially for people that are taking medications or have medical conditions, it's not such a good idea. So my favorite thing to do is to use a little bit of warm salt water. It's like the grandma's recipes. And that just not a lot of salt, just a little bit of salt with warm salt water a couple of times a day. It kind of kills all the bad bacteria, and it gives you a little bit of a fresh breath, which I'm a big fan. Also, like maybe, like a little sugarless, like a sugarless candy or sugarless gum. It's a good idea. But, like gum is not so good also for people, especially at this time that we're going through a lot of stress. It's not good on your TMJ, on your, so that's why, like, we usually say you have to chew the gum for as long as that kind of like the sweetness goes away, and then you throw it away, because it's not so good for a prolonged period of time.
Okay, so, and the other thing I want to talk to you about bad breath, because I've heard, and you can maybe tell me if this is true or not, that when people are losing weight, you know, when they're actively seeking to lose weight, that sometimes their breath can really smell because of that. Is that true or false?
You know, like that's something that's mostly on the medical doctor side, but sometimes it is true that the bad breath can come from your stomach. So people that suffer from stomach problems, they usually do have bad breath. Especially if you are smelling that kind of like an acidic kind of bad breath, we usually suggest the patients to go to the doctor and make sure that they see them and take treatment. Because it is true that if you are seeing that all your mouth has no problems, like let's say no cavities, no periodontal disease, no gingivitis, no other problems in the mouth, you have very good oral hygiene, you are seeing a dental professional very often, but you still feel that you have bad breath, that's our next thing to do, is to refer the patient to the medical doctor and make sure that they don't have medical condition mostly related to the stomach.
Okay, and just quickly before we wrap it up, gingivitis, that's different than what we were talking about before. So please tell me what gingivitis is. I mean, I think we've all heard it from the commercials, but what's the clinical definition?
Yeah. Gingivitis is probably the most common disease that people can have, and is those red gums that you can see when you have bleeding gums, and that's called gingivitis. It is reversible, so with taking good care at home and seeing your dental professional, that can be treated, and you can have healthy gums like before. So it's a great thing that you need to do like a little bit more extra work on your side.
Okay, so the flossing, basically.
Yeah, brushing, flossing is very, very important.
Okay, excellent. So if people want to connect with you and they want to maybe find out a little bit more about their bad breath, where can they find you?
So they can find us on like our website is DentalX.ca. We are very active on our social media. So Instagram is DentalX.ca. Twitter is at DentalX Smiles, or on Facebook, DentalX.
Okay, excellent. Thank you so much for joining me. I look forward to having you back. We'll talk soon.
Thank you so much.